Hello everyone. So we are going to discuss comprehensive 2 MCQ top 50 question. So let's start with the question number 1. So the unit secretary who transcribed the physician prescription asked the nurse to interpret it an eligible prescription. The nurse should do what? You have 4 options on the screen. Let me know the right answer. So what do you think, what will be the right answer of this question? So answer number 3 will be the correct answer. Firstly, clarify the prescription by calling the physician. Now question number 2 on the screen. A client with cholecystitis is taking propanthenol bromide. The expected outcome of this drug is. What will be the outcome of this drug? You have 10 seconds to answer the question. So answer number 2 will be the correct answer. Decreased biliary spasm. Now question number 3 is on the screen. The nurse refers the patient of a child with cystic fibrosis to organization that help the families with children who have disease. These organizations are especially beneficial for parents by helping them. 4 options are on the screen and you have 10 seconds to select the right answer. Yes, the answer number 3 is the correct answer. Very good. So now question number 4 on the screen. After a bronchoscopy with a biopsy, the nurse assesses the client. Which of the following signs should be reported immediately to the physician? So do it fast. Let me have the answer within 10 seconds. Exactly. Very good. Answer number 4 is the correct answer. Now read the question number 5. A client tells the nurse that hospital food is horrible. Which of the following is the most appropriate response by the nurse? Read all the question options. Yes, exactly. 3 is the right answer. Question number 6. The nurse must be aware that adverse drug reaction in the elderly clients may be underestimated because of what? You have 10 seconds to answer the question. Yes, very good. Answer number 3 is the correct answer because physical or physiological symptoms are attributed to aging effect. So इसकी वजह से हम underestimate कर सकते हैं उनके adverse drug reaction को. Now question number 7. An elderly man experiences a thrombotic cerebrovascular accident and subsequent flaccid hemiplegia of right side. When planning care of the client, rehabilitation begins when? So you have 4 options. So what will be the right answer? When will be the rehabilitation begins? Perfect. Answer number 2 is the right answer. When the client is admitted to the hospital, we have to start the rehabilitation. Now question number 8. An unmarried pregnant teenager tells the nurse that she is undecided about having an abortion or giving the baby up for adoption. The best response for the nurse to offer is which of the following? Yes, answer number 3 is the correct answer. Now question number 9 is on the screen. When administering blood, the nurse must check the name on the label of the blood with the name of client's what? So तब हम बीटी देते हैं, कोई भी ब्लड इनिशिएशन करते हैं, तो हम पेशेंट का नेम और लेबल कहाँ से चेक करते हैं? So let me know the answer in 10 seconds. Very good. Answer number 2 is the correct answer. Now question number 10. A client is diagnosed with syndrome of inappropriate antidiuretic hormone, that is SIADH. The nurse should assess the client for which alteration in the fluid and electrolyte balance. So what will be happen in the condition of SIDS? क्या imbalance हो सकता है? Yes, second is the correct answer. Decrease sodium level, because due to increase in antidiuretic hormone, there will be fluid retention in the body, which will cause the decrease serum sodium level. Now question number 11. The client is admitted to emergency department with crushing chest injury sustained in a car accident. Which of the following signs indicate a possible pneumothorax? Yes, third will be the correct answer. Now question number 12. Which of the following statements by a client taking a valproic acid for bipolar disorder indicates that further teaching about the medication is necessary? So what will be the right answer? Answer number 2 will be the correct. I can chew the pill if necessary. So we can never chew the valproic acid pills. Now question number 13. A nurse is obtaining the history of an infant with suspected acute otitis media. What should the nurse ask the patient for? What will be the right answer? So answer number 1 is the correct. Position of infant when taking the bottle. Because if someone is feeding the baby in supine position, it will increase the chances of otitis media. बिकॉज जो मिल्क है वो इश्कियन ट्यूब में भी जा सकता है, जिसकी वजह से ओटाइटिस मीडिया हो सकता है अगर हम सुपाइन पोजीशन में बेबी को फीड करते हैं तो. Now question number 14. A client is having elective surgery under general anesthesia. Who is responsible for obtaining the informed consent? ये तो हमने आपको पढ़ाया भी था NF के अंदर. So what will be the right answer? Yes, the surgeon. Yes, because consent हमेशा वो लेगा जो परफॉर्म कर रहा है. So nurse will only act as a witness. Now question number 15. A family of an elderly client with a terminal cancer inquires about hospitals or wait. Just leave this question because now question number 16. A primary gravida client at 8th week of gestation tell the nurse that she don't like milk. To ensure the client consume an adequate intake of milk products, the nurse should instruct the client that an 18 oz 250 ml glass of milk is equal to which of the following? So 250 ml of glass of milk is equal to which of these following? You have 10 seconds to answer. Answer number 3 will be the correct answer. Now question number 17. A primary gravida client at 35 weeks of gestation is scheduled for biophysical profile. After instructing the client about the test, which of the following, if stated by the client as one of the parameters of this test, indicate effective teaching? So the test is biophysical test. So अगर पेशेंट क्या ऐड कर रहा है उन स्टैंडर्ड्स के अंदर तो हम उसकी टीचिंग को इफेक्टिव मान सकते हैं. यू हैव 10 seconds to answer. Yes, correct. One answer is the correct. So now question number 18. When caring for a child who has been receiving long-term steroid therapy, the nurse should assess the child for what? Yes, because steroid cause face and trunk obesity. Fat वहाँ पे ज़्यादा डिपॉजिट होता है if you are taking steroids. Now question number 19. The nurse manager has assigned a nurse as a circulating nurse for surgical abortion. The nurse is a Roman Catholic and wishes to refuse to participate in the abortion. The nurse manager of operating room should do what? You have 10 seconds to answer. So answer number 3 will be the correct answer. Change the assignment without any comment. Because of their religious belief, अगर कोई refuse कर रहा है